Cystitis and UTI in women. If you've ever been wondering why does it hurt when I pee, then you're not alone. A burning or painful sensation when you pee is a typical symptoms of a UTI. And more often than not, they happen to women. In fact, women are around 8 times more likely to get a UTI than men. The symptoms of a UTI can be tiring and uncomfortable, and it might be surprising to you how uncomfortable it feels. What is a UTI? Well, in most cases, a UTI is caused by a bacteria getting into your urinary tract. The most common bacteria a UTI is caused by is called E. coli, which is responsible for around 90% of cases. Remember that your urinary tract is made up of different parts which can all get infected. These are your urethra, which is the tube that takes the pee out of your body, the bladder, which stores the pee until it leaves your body, the ureters, which are 2 thin tubes that take urine from your kidneys to your bladder, and lastly your kidneys, which are small organs that sit above your hips, which create your urine. The most common forms of a UTI happen in your lower urinary tract, and that's when you have cystitis, which is when your bladder is infected, or urethritis, which is when your urethra is infected by bacteria. An upper urinary tract infection is when the bacteria has infected your kidneys. The medical name for this is called pyelonephritis. You have a higher risk of a kidney infection if you have frequent bladder infections or a structural problem in your urinary tract. What's the difference between cystitis and a urinary tract infection? Cystitis is when your bladder is infected. A UTI stands for urinary tract infection and refers to any part of your urinary tract. With a UTI, you can't generally tell where the infection is in your urinary tract, but they're diagnosed and treated in similar ways, so it doesn't matter. Urinary tract infections in women. Your body has 2 exits where your waste products leave from, and that's your pee hole and your poo hole. Generally in women, these holes are closer together. That means it's easier for the bacteria to spread from your back passage towards your pee hole. It's worth remembering that women have a smaller urethra than men. So what are the risk factors of a UTI? Well, toilet hygiene. If you're wiping from back to front, it makes it easier for the bacteria to travel from your back passage towards your urethra. Having regular sex in women, which is more likely to introduce bacteria towards your urethra. If you're pregnant, this is an additional risk factor. Your age is a risk factor. After the menopause, your estrogen levels drop, causing your vaginal wall and your urethra to become thinner and more prone to infections. If you have additional health conditions like diabetes, this can lower your immunity and reduce your chances of being able to protect yourself from these kind of infections. If you have a kidney stone or a blockage, this can stop the flow of urine coming out of the body and make it more likely to get an infection. The main symptoms of a UTI that affect your bladder and your urethra are burning or pain when you pee, needing to pee more urgently and more often, needing to go to the toilet at night, and pee that looks cloudy. Some women also get pressure in their lower belly. You may in some situations get a kidney infection, and that's if the bacteria travel from your bladder up to your kidneys, and then you may have additional symptoms which include pain in your lower stomach or your back, just underneath your ribs, feeling nausea or vomiting, blood in your pee, and having a high temperature. How long does a UTI last? The reality is some UTIs go away on their own in around 2 to 3 days. If a UTI hasn't cleared up in 48 hours, it's best to see a doctor who will be able to give you antibiotics if you need it. Generally, if you need antibiotics, this is given for around 3 to 5 days, after which your infection should be improved. What makes a UTI recurrent? A recurrent UTI is classed as when you get 2 UTIs in 6 months or 3 or more UTIs in a year. You may be at risk of recurrent UTIs if you have regular sex, a new partner, use spermicide, are going through the menopause, or have problems in the structure of your urinary tract. So some self-care and home remedies if you have a UTI. This will include preventative measures which lower your chance of getting UTI, which includes checking your toilet hygiene, always make sure you wipe from front to back, pee as soon as you get the urge, don't hold in urine for long periods of time if you feel you need to pee. Pee as soon as possible after sex. This flushes away the bacteria that might be lingering near your urethra. Staying hydrated is important, so make sure you're drinking the recommended amounts to help flush out any infections before they develop. Avoid douching and feminine hygiene sprays. It's better just to stick to plain water to wash your vagina. How to get rid of a UTI. Home remedies you can try include resting and drinking lots of water throughout the day so your urine is pale coloured, taking painkillers if you need some, using a hot water bottle to help ease your discomfort. If you have mild symptoms, a pharmacist can advise you on what over-the-counter medications are available. Remember, if you've had an infection for around 48 hours, it's best to see a doctor who will be able to assess you. When to see a doctor for a UTI? Your doctor can help you deal with a UTI by making a diagnosis and giving you the right treatment if you need it. It's also important to see a doctor if you keep getting UTIs, who will be able to look into any possible causes.
See a doctor if you have UTI symptoms for the first time, you're a man with UTI symptoms, you are currently pregnant, you are elderly, you have symptoms of a UTI after surgery, your symptoms are getting worse or have not improved within 2 days, or your symptoms have come back and you have finished treatment.
How is a UTI diagnosed? Your doctor or nurse will discuss your symptoms, and it's more likely that you'll need a urine sample and they'll dip it to see if there's any bacteria inside. In some cases, we send that urine sample off to the lab for a urine culture. This is when we grow the bacteria in your urine to see what the cause is. How does your doctor treat a UTI? Generally, we prescribe a short course of antibiotics, usually involving a 3-day course. In some cases, you need a longer course, like if you're pregnant, but your doctor will fill you in on how long you have to take the antibiotics for. Commonly asked questions about a UTI. Can drinking cranberry juice prevent a UTI? You've probably heard that drinking cranberry juice can get rid of a UTI or reduce your chances of getting a UTI again. But the reality is there's not much difference between drinking cranberry juice versus just drinking plain water. Can you have sex when you have a UTI? It's advisable to avoid penetrative sex, including sex toys, when you have a UTI. And that's because sex could be painful or irritate the area that's already inflamed. But that doesn't mean you have to avoid all forms of intimacy if you choose not to. Thank you for watching, and I hope you found it useful.